Hi. Hello to all of you. Just one moment. Okay. So, hello to all of you students. And started. And welcome to this one shot series of anatomy from PW MedED. Hi, Bhavish. So, interior of cranium में क्या पढ़े या फिर skull में क्या पढ़े? This is a very common question asked by the students. See, norma frontalis, norma lateralis, norma verticalis, norma occipitalis, this we study. That is just for your understanding purpose. What is very important in the exams is the interior of the cranium. This is what I'm going to tell you. हाँ तो interior of cranium बहुत ज़्यादा important है. Examiner will have the skull with him and he will have the probe. वो probe वो है ना foramen में he will put the probe and he'll be asking you the name of the foramen and the structures passing through the foramen. Hi Arya. Okay, so let us understand the interior of the skull. We've cut the cranium, we've cut the skull, we have opened the skull, and आप skull के अंदर देख रहे हो. Okay, we are looking inside the skull. Look, we have cut the skull, and you're looking inside the skull. What is this and what is this? इसे क्या बोलते हो? This is what we call as the outer table. This is what we call as the inner table of the skull. Outer table and inner table. Hi, hi. ठीक है, ठीक है. हिंदी में भी बोलता हूँ. ठीक है. सो आउटर टेबल होता है, इनर टेबल होता है, बीच में एक वैस्कुलर टिश्यू होता है विच इज नोन एज अ डिप्लोई. तो बस ये फोरामेंस है, इतने फोरामेंस आपको याद करने हैं. दिस मच फोरामेंस यू रिमेंबर, दैट इज मोर देन इनफ. ओके, मोर देन इनफ. सो विल स्टार्ट विद द इंटीरियर ऑफ द स्कल. इंटीरियर ऑफ द स्कल. सी हाउ आई एम ड्रॉइंग दिस. ये मैं कैसे ड्रॉ कर रहा हूँ, जस्ट देख लीजिए एंड देन यू ट्राई टू अंडरस्टैंड दिस. ओके, now this bone we call this as the lesser wing of sphenoid bone. इसे बोलते हैं lesser wing of sphenoid. अब ये जो bone है ना, this one, ये this is what we call as the greater wing of sphenoid. ये lesser wing of sphenoid bone है. एक sphenoid bone होता है हाँ in the skull bones which looks like a butterfly. ये butterfly के जैसे दिखता है. Hi hi, hello to all of you. Hello. हाँ, आई एम स्टार्टिंग विद इंटीरियर ऑफ स्कल. ठीक है बच्चों. सो एक बोन होता है स्कल के अंदर. आउट ऑफ ऑल दिस बोन्स विच लुक्स लाइक अ बटरफ्लाई, ये बटरफ्लाई के जैसे दिखता है. ये है स्पिनॉइड बोन. स्पिनॉइड अगर मैं साइड पे ड्रॉ करूं तो इसे बोलते हैं लेसर विंग ऑफ स्पिनॉइड. ये है ग्रेटर विंग ऑफ स्पिनॉइड. ये है बॉडी ऑफ द स्पिनॉइड एंड इसके दो पैर होते हैं. देयर आर टू लेग्स ऑफ द स्पिनॉइड. हाँ, व्हाट इज दिस? दिस आर द टेरिगॉइड प्लेट्स. इसे हम बोलते हैं टेरिगॉइड प्लेट्स. हाँ, हाय हाय. So this is the lesser wing, that's a greater wing, that's the body of the sphenoid. A body of the sphenoid के अंदर there is a gland here. What is this gland? Anyone? What is this gland? Anyone? What is this gland inside the body of sphenoid? Anyone? नीट के लिए प्रिपेयर कर रहे हो? गुड. What is this known as? This is the pituitary gland. ये जो pituitary gland होता है ना, that lies in the body of the sphenoid. फिर we have lesser wing, we have greater wing, and we have two legs. These are the pterygoid plates. The medial and the lateral pterygoid plate होते हैं. So this sphenoid bone looks like a butterfly. ये butterfly के जैसे दिखता है sphenoid bone. ठीक है. तो अब यहाँ पे देखिए, what is this? That's a lesser wing of sphenoid. This is the greater wing of sphenoid, and ये जो है, this is the body of the sphenoid. Body. अगर स्कल में देखना है, लुक एट दिस. व्हाट इज दिस? लेसर विंग ऑफ स्फीनॉइड. ये है लेसर विंग ऑफ स्फीनॉइड. ये है ग्रेटर विंग ऑफ स्फीनॉइड. ये है ग्रेटर विंग एंड दिस इज द बॉडी ऑफ द स्फीनॉइड. दैट्स द बॉडी ऑफ द स्फीनॉइड ग्लैंड. हाँ, इसके अंदर क्या होता है? इसके अंदर होता है पिट्यूटरी ग्लैंड. हाँ, द व्हाट सिट्स इनसाइड दिस इज द पिट्यूटरी ग्लैंड. पिट्यूटरी विहान, पिट्यूटरी ग्लैंड. फाइन. एंड बेस ऑफ द स्कल पे देखोगे ना, स्कल के नीचे की तरफ, सो यू विल फाइंड टू प्लेट्स, द मीडियल एंड द लैटरल टेरिगॉइड प्लेट. Vishwanand, I'll talk to you later. Okay, just let me finish this. Fine. So this is the sphenoid. Okay, just have a look at this. Now, what is this bone? Just wait, I'll talk to you later. What is this bone? Now, this is very hard like a rock. ये rock की तरह होता है. This is very hard like a rock, and this is what we call as the petrous part of temporal bone. Petrous part of temporal bone. तो what is this? ये जो मैंने draw किया है, this is the petrous part of temporal bone. हाँ, ये है petrous part. ये है lesser wing of sphenoid. ये है greater wing of sphenoid. That's a greater wing of sphenoid. That's a body of sphenoid. This is the temporal bone. Temporal bone का एक part होता है which is known as the petrous part of temporal bone. ठीक है? Now ये जो lesser wing of sphenoid है and the petrous part of temporal bone divides the skull into 3 fossae. ये ऐसे 3 fossae बनते हैं. Just have a look at this. You find it? These are the 3 fossae. Okay, fine. These are the 3 fossae. हाँ. This may not be up to the mark, that's fine. So what is this fossa known as? ये जो देख रहे हो, this is the anterior cranial fossa. ये जो देख रहे हो, that's the middle cranial fossa. And what's this? Posterior cranial fossa. ऐसे 3 fossa होते हैं, anterior, middle and posterior cranial fossa. That's the anterior cranial fossa. ये होगा middle cranial fossa. And ये पीछे कौन है? That's the posterior cranial fossa. ये clear है बच्चों? This is clear? So anterior, middle and posterior cranial fossa. Perfect. Now try to understand this various fossae. इसके अंदर जो foramen है वो अपन समझ के लेते हैं. We'll just understand the various foramen. Okay, just have a look at this. Okay, I'll have to clear this. ये मैं clear कर लेता हूँ. Okay, I'll start. In the anterior cranial fossa, यहाँ पे एक plate होती है. There's a plate here जो है ना ऐसे perforated होता है. Perforated plate. Anything with perforations is known as what? Cribriform. And this is what we call as the cribriform plate of ethmoid bone. You can see this. This is the cribriform plate of ethmoid bone. अगर यहाँ से नीचे जाओगे, if we go from here, अगर यहाँ से नीचे जाते हो, we go in the nose के अंदर जाओगे. So what comes in from here? यहाँ से क्या अंदर आएगा? What will come from here inside the skull? The olfactory nerves. So olfactory nerves smell. The olfactory nerves will begin from the upper part of the nose and they will enter the skull through the cribriform plate of ethmoid bone. समझ में आ रही है? Cribriform plate of ethmoid. I will see that later. Now this thing, I'll just put here number 1. यहाँ पे numbers लगाता हूँ, so it will be easy for you to understand. Okay, have a look. So this is number 1, this is number 2. So 1 is the cribriform plate of ethmoid. बस इतना याद रखना, cribriform plate of ethmoid bone. What comes in from here? Olfactory nerves. What is this? Number 2. Number 2 is known as the Crista Galli. Crista Galli. And number 3, यहाँ पे there is a crest here. Yeah, this is known as the frontal crest. ठीक है? So anterior cranial fossa में क्या होगा? Cribriform plate of ethmoid. यहाँ से olfactory nerves आएंगे. This is the Crista Galli and this is the frontal crest. Now what is this bone? This is the frontal bone. अगर आप इसे break करते हो, look at this. If you break this, one moment. If you break this, अगर इसे break करते हो तो अपन कहाँ जाएंगे? Where will we go? In the orbit. हम कहाँ जाएंगे? Orbit के अंदर. We'll be going in the orbit. If you break this, we go into the orbit. This is what we call as orbital plate of frontal bone. ये कौन सा bone है? Frontal bone. अगर इसे आप break करोगे, हाँ, ये ना, you'll be breaking this to dissect the orbit. ऑर्बिट को डिसेक्ट करने के लिए यू हैव टू ब्रेक दिस बोन. चिसल एंड हैमर से ये तोड़ोगे, देन वी गो इनटू द ऑर्बिट. दिस इज व्हाट वी कॉल एज द ऑर्बिटल प्लेट ऑफ फ्रंटल बोन. ऑर्बिटल प्लेट ऑफ फ्रंटल बोन. ठीक है? तो दिस इज द एंटीरियर क्रेनियल फोसा. जस्ट बी क्लियर, जितना मैं बोल रहा हूं उतना परफेक्ट कर लो. दैट्स इट. Cribriform plate of ethmoid, Crista Galli, occipital crest. This is the orbital plate of frontal bone, and यहाँ पे you can see a foramen here. You can see a foramen here. What is this foramen known as? This is the optic canal. So if I draw it here, something like this, what is this? Optic canal. Optic canal. What passes through the optic canal? Optic nerve. Optic nerve अंदर आती है, skull के पास आती है. आई से रेटिना है, रेटिना से नर्व निकलती है. दैट्स द ऑप्टिक नर्व. दिस ऑप्टिक नर्व विल कम इनसाइड द स्कल. सो व्हाट कम्स इन फ्रॉम द ऑप्टिक कैनाल? एक है ऑप्टिक नर्व, दूसरा है ऑफ्थैल्मिक आर्टरी. वेरी गुड. optic nerve and ophthalmic artery. Now optic nerve is known as a pregnant nerve. What is a pregnant nerve? जो nerve के अंदर artery होती है. हाँ हर्ष, very good. जो nerve के अंदर artery होती है, such nerves are said to be pregnant nerves. Okay, what is a pregnant nerve? जो nerve के अंदर artery है, that is known as a pregnant nerve. So optic nerve के अंदर, which is the artery, can anyone tell me? हाँ, optic nerve के अंदर एक artery होती है. So suppose if I draw this optic nerve like this, and I draw an artery inside the optic nerve, and this is the ophthalmic artery. ये है ophthalmic artery. What is this artery? Anyone? चलो guess करो बच्चों, guess करो. हर्ष? Yes, अमीना, विश्वन्ना, लीजा, विहान, चलो guess कर लो. What is this artery which is in the optic nerve? That's a central artery of retina. Central artery of retina. So optic nerve के अंदर होती है central artery of retina. So optic nerve is said to be a pregnant nerve. और भी एक nerve है body में, that's a sciatic nerve. Sciatic nerve के अंदर एक artery होती है. There's an artery within the sciatic nerve. Hi Ranjit. So that is known as arteria nervi sciatica. So that's an artery within the sciatic nerve. That's in the lower limb. So sciatic nerve is a pregnant nerve. दूसरी है optic nerve. याद रखना, these are all PG level things. So बस remember this. Fine, this is clear. So that's the anterior cranial fossa. Now we come here. अभी पीछे आते हैं, पीछे. We'll come here to the middle cranial fossa. See this lesser wing of sphenoid. ये lesser wing of sphenoid देख रहे हो? Lesser wing of sphenoid. हाँ, ये lesser wing of sphenoid के नीचे look at this. You can see a big foramen. मतलब ये ऐसा foramen था. एक मिनट, दिस वाज द फोरामेन. ये फोरामेन को स्ट्रेच किया हमने. वी हैव स्ट्रेच्ड दिस फोरामेन. फोरामेन को स्ट्रेच किया. दिस इज व्हाट वी कॉल एज अ फिशर. हाँ, सो दिस इज नोन एज द फिशर. ये देखो, दिस, ये देख रहे हो, ये दिस इज व्हाट वी कॉल एज अ फिशर. हाँ, इसका नाम है सुपीरियर ऑर्बिटल फिशर. सुपीरियर ऑर्बिटल फिशर. सुपीरियर ऑर्बिटल फिशर कहाँ पे? ये लेसर विंग ऑफ स्फेनॉइड है ना, ये है सुपीरियर ऑर्बिटल फिशर. अगर मुझे ड्रॉ करना है, ये देखिए, दिस इज द सुपीरियर ऑर्बिटल फिशर. लेसर विंग ऑफ स्फेनॉइड के नीचे है. ओके फाइन. अगर मैं ये सुपीरियर ऑर्बिटल फिशर से ऐसे देखूं, इफ आई सी थ्रू दिस सुपीरियर ऑर्बिटल फिशर, व्हाट डू आई सी इन फ्रंट? आगे क्या दिखेगा मुझे? ऑर्बिट. सुपीरियर ऑर्बिटल फिशर से आगे क्या है? ऑर्बिट. इन अदर वर्ड्स एनी स्ट्रक्चर फ्रॉम द स्कल, अगर स्कल में कोई भी स्ट्रक्चर है, अगर उसे ऑर्बिट में जाना है, एनी स्ट्रक्चर फ्रॉम द स्कल, इफ इट हैज टू गो टू द ऑर्बिट, इट हैज टू पास थ्रू दिस फिशर. इसका नाम है सुपीरियर ऑर्बिटल फिशर. सुपीरियर ऑर्बिटल फिशर. सो कैन एनीवन टेल मी who goes to the orbit? The nerves. The nerves are going to the orbit. The nerves which are supplying the muscles of the eyeball. Bolo, which are the nerves which supply the muscles of the eyeball? Any guesses? चलो guess कर लो बच्चों. So this is what we call as the superior orbital fissure. हाँ, मैंने short में लिखा है superior orbital fissure. And superior orbital fissure से अगर आप निकलते हो, where will we go? In the orbit. So which are the nerves which go to the orbit? Very good. This 3, 4 and 6 nerve. 3rd, 4th and 6 जो muscles of the eyeball को supply करेंगे. And see, suppose इधर है ना, what do I tell you? How do I tell you? अगर कुछ लगा आंख में, some dust particle गए आंख में, तो you suddenly close your eyes. मतलब there must be some sensory supply to the eye. And which is the nerve which is sensory to the eye? That's the ophthalmic division of trigeminal nerve. Ophthalmic division of trigeminal nerve. ठीक है? So who enters the orbit through the superior orbital fissure? The 3rd, 4th, 6th and the ophthalmic division of trigeminal nerve. परफेक्ट है. बस दिस यू हैव टू नो. जो मैं बोल रहा हूं, इट शुड बी ऑन द टिप ऑफ योर टंग. ये पूछेंगे. फाइन, परफेक्ट, वेरी गुड. नाउ कम हियर. दिस इज द ग्रेटर विंग ऑफ स्फेनॉइड. ये है ग्रेटर विंग ऑफ स्फेनॉइड. अब ग्रेटर विंग ऑफ स्फेनॉइड के अंदर, दिस इज वन फोरामेन, दिस इज लार्ज फोरामेन, दिस इज 3rd फोरामेन, एंड यहाँ पे होता है 4था फोरामेन. ओके, इफ एनीवन कैन टेल मी व्हाट आर दीज वेरियस फोरामेन्स, आई जस्ट राइट A, B, C एंड D. ये ऐसे ही दिखते हैं. Just have a look at this. So this are the foramen. I'll just mark here. This is A, this is B, this is C, and this is the D foramen. बस ये 4 foramen. You should know. Yes. What is A? A is the foramen rotundum. I'll just write it here. A is foramen rotundum. एंड फोरामेन रोटेंडम से क्या निकलता है? व्हाट लीव्स द स्कल थ्रू द फोरामेन रोटेंडम? दैट्स मैक्सिलरी नर्व. यहां से क्या जाता है? मैक्सिलरी नर्व. ठीक है. व्हाट इज बी? बी इज द फोरामेन ओवेल. foramen ovale. And what passes to foramen ovale? MALE structures. ये structures mnemonic है. M is mandibular nerve. M is mandibular nerve. हाँ, NEET is worth बच्चे. If you want to become a doctor, if you want to become a good doctor, NEET is very important. Fine. So foramen ovale is MALE. M is mandibular nerve. A is accessory meningeal artery. L is lesser petrosal nerve. And E is the emissary vein. E is the emissary vein. ठीक है. So ठीक है. M is mandibular nerve. A is accessory meningeal artery. L is lesser petrosal nerve. E is emissary vein. ये याद रखना है. अब what is C? C is foramen spinosum. Foramen spinosum. And D is foramen lacerum. Foramen lacerum. ये याद रखना. ठीक है. ठीक है बच्चों. Look at this. So यहाँ पे ना एक बड़ा सा गैंग्लियन होता है. I'll just draw in this slide. हाँ, ये slide मैं draw करता हूँ तो it will be easy for you. Look at this. There's a big ganglion here. यहाँ पे एक बड़ा सा गैंग्लियन है. इसका नाम है trigeminal ganglion. Trigeminal ganglion. And this trigeminal ganglion has got 3 branches: ophthalmic, maxillary, mandibular nerve. Ophthalmic, maxillary, mandibular nerve. Okay, these are the branches of trigeminal ganglion. So ophthalmic division goes where? Superior orbital fissure. Maxillary division leaves the skull through foramen rotundum, and mandibular division goes through foramen ovale. ठीक है. ये trigeminal ganglion की 3 main branches होता है: ophthalmic, maxillary, mandibular. Ophthalmic division passes through superior orbital fissure. Maxillary passes through foramen rotundum. Mandibular passes through foramen ovale. Foramen ovale. ठीक है बच्चों, क्लियर है? सो फोरामेन रोटेंडम से क्या जाएगा? मैक्सिलरी नर्व. फोरामेन ओवेल से वो MALE निमोनिक याद रखना. डोंट टेल दिस निमोनिक टू द टीचर. व्हाट पासेस टू फोरामेन ओवेल? सर मेल. डोंट से दैट. ओके. So that is just for you. Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. What passes to foramen spinosum? Middle meningeal artery and nervous spinosus. Middle meningeal artery and nervous spinosus. And foramen lacerum से कौन आता है? Internal carotid artery. Internal carotid artery. Perfect है. ये foramens you should know. हाँ, ये foramens you have to know. कुछ doubts है बच्चों? Any doubts anyone has? Foramen. Okay, ये clear है ना? Is this clear to all of you? Okay, just tell me. Foramen ovale से क्या जाता है? Foramen ovale. That's MALE. What's M? Mandibular nerve, accessory meningeal artery, lesser petrosal nerve, emissary vein. Foramen spinosum. What passes is middle meningeal artery and nervous spinosus. Middle meningeal artery and nervous spinosus. Perfect to all of you. And foramen lacerum से क्या जाता है? Internal carotid artery. फोरामेन लैसेरम से क्या जाता है? इंटरनल कैरोटिड आर्टरी. फाइन, बस इतना. एंड सिंपैथेटिक प्लेक्सस अराउंड द इंटरनल कैरोटिड आर्टरी, जिससे बनता है डीप पेट्रोसल नर्व. डीप पेट्रोसल नर्व. फाइन, दैट्स फाइन. सो दिस इज क्लियर. सो मिडिल क्रेनियल फोसा क्लियर है बच्चों? इतना फोरामेन याद रखना है. यू शुड बी नोइंग दिस. द एग्जामिनर विल पुट अ वायर इन द फोरामेन एंड यू टेक द स्कल. देखो कौन से फोरामेन में वायर है, आंसर अकॉर्डिंगली. Be very clear, be 100% sure about it. Fine. Now, coming behind. What is this behind? ये पीछे कौन है? This is the posterior cranial fossa. ये है posterior cranial fossa. इसके boundaries क्या होंगे? इसके boundaries है petrous part of the temporal bone and the occipital bone. Petrous part of temporal bone and the occipital bone. अब यहाँ पे there is a big foramen here. What is this big foramen? That's the foramen magnum. ये foramen magnum. यह है foramen magnum. There's a slope here. This slope is known as clivus. इसको बोलते हैं clivus. Look at this. So ये जो slope देख रहे हो, slope, इसका नाम है clivus. What lies here? यह है clivus. What lies on this slope? The brain stem. The brain stem lies on the slope. And brain stem मतलब midbrain, pons and medulla. अब medulla यहाँ से निकलेगा. Medulla will go outside the skull. Medulla will get outside the skull through the foramen magnum. Fine. So who lies on the clivus? The brain stem. Brain stem. Perfect है. Okay, so now come to this. What is this now? ये कौन है? This is the petrous part of temporal bone. This is very hard. इसके अंदर क्या होता है? इसके अंदर होता है middle ear and internal ear. In the petrous part of temporal bone, there's middle ear and internal ear, and there is a foramen here. Anyone? What is this foramen known as? Petrous part of temporal bone. यहाँ पे एक foramen है. अगर ये foramen से जाते हो, so we go inside the ear. We go inside the ear. Vishwanna. Vishwanna. I told no. It is worth giving NEET. Yes. Okay, so what is this foramen? अगर यहाँ से अपन अंदर जाते, we go inside the ear. So this foramen is known as the internal acoustic meatus. Internal acoustic meatus. But only if you are interested, come to medicine. अगर interest है तो medicine में आना, मेहनत करनी है तो medicine में आना. Fine. Otherwise, So that is internal acoustic meatus. Inside this internal acoustic meatus, who enters into this? The 7th nerve, 8th nerve, and labyrinthine artery. 7th nerve, 8th nerve, and labyrinthine artery enters the internal acoustic meatus. समझ में आ रहा है? ये क्या है? ये बाहर से देख रहे हो? That's the external acoustic meatus. अगर ईयर को बाहर से जाना है, बाहर से ईयर के अंदर जाना है, तो दैट्स द एक्सटर्नल acoustic meatus. स्कल के अंदर से ईयर में जाना है, दैट्स द इंटरनल acoustic meatus. Internal acoustic meatus. Clear to all of you? Fine. Now there's a big foramen here. यहाँ पे एक बड़ा सा foramen है जिसका नाम है jugular foramen. This is the jugular foramen. इसके 3 compartments है. What is this? Jugular foramen. This is very important. ये बहुत important है. So have a look at this. This is the internal acoustic meatus. That's the jugular foramen. Now what passes through the jugular foramen? Anyone? Jugular foramen के 3 compartments होते हैं. One is anterior, one is middle, and one is posterior. Anterior, middle, and posterior compartment. What passes through the anterior compartment is the inferior petrosal sinus. Inferior petrosal sinus. Middle compartment से कौन जाता है? 9th, 10th and 11th cranial nerves. And posterior compartment से कौन जाता है? Sigmoid sinus. Sigmoid sinus. So these are the structures. Okay, they pass through. Yes, the jugular foramen. Okay, jugular foramen के 3 compartments होता है, anterior, middle and posterior. Fine. So anterior compartment से क्या जाता है? Inferior petrosal sinus. Middle compartment से क्या जाता है? 9th, 10th and 11th cranial nerves. And posterior compartment से क्या जाता है? Sigmoid sinus. Yes, very good. If you are ready to do hard work, anytime, welcome to medical profession. Yes, it's only hard work, pure hard work. Fine, clear to all of you. So that's the jugular foramen. एक बार देख लो वापस. तो ये है internal acoustic meatus, ये है jugular foramen. This is a big foramen जिसका नाम है Foramen Magnum. And यहाँ पे एक foramen होता है. This is what we call as the hypoglossal canal. Hi medico. That's a hypoglossal canal. Okay, look at this. यहाँ पे एक foramen है. This is the hypoglossal canal. What passes through this? Hypoglossal nerve. Hypoglossal nerve passes through this. Perfect है? So these are the structures present in the posterior cranial fossa. समझ लो इसको. Posterior cranial fossa के boundaries क्या होंगे? On either sides, that's the petrous part of temporal bone. पीछे कौन है? Occipital bone. This is the internal acoustic meatus. इससे क्या जाएगा? 7th nerve, 8th nerve, labyrinthine artery. That's the jugular foramen. That's the foramen magnum. And यहाँ पे है hypoglossal canal, जिससे जाएगा hypoglossal nerve. Hypoglossal nerve. Perfect है? So this is about the interior of the skull. This is what you are supposed to know. अभी बच्चों, just tell me one thing. Just try to understand this. Look, कितने cranial nerves है? 12. 12 cranial nerves है. Out of this, only the first and the second nerve, they come inside the skull. वो skull के अंदर आते हैं. बाकी जितने भी cranial nerves है 3 to 12, they will go outside the skull through the foramens. ठीक है? So first nerve कैसे skull के अंदर आती है? Anyone? How does the first nerve enter the skull? Through the cribriform plate of ethmoid bone. How does the second nerve come? Second nerve passes through the optic canal. Optic canal से जाती है optic nerve. The second nerve comes inside the skull through the optic canal. ठीक है, that's the optic nerve. Perfect है. Okay, तो दो nerves skull के अंदर आते हैं. अब जो बचे हुए nerves हैं, they will go outside the skull. चलो, we'll start. 3, 4, 6. How do they get out of the skull? Answer. Answer now, bachcho. Come on, answer. 3, 4, and 6 nerve. How do they get outside the skull? All of you. Now answer. The question is open to all of you. Anyone? 3rd, 4th, and 6th nerve. How does it get outside the skull? The superior orbital fissure. Very good. That's a superior orbital fissure. 3, 4, 6. Fifth nerve divides into 3 branches. The ophthalmic, maxillary, mandibular. Ophthalmic कैसे बाहर जाती? Foramen through the superior orbital fissure. Maxillary nerve, foramen rotundum. Mandibular nerve, foramen ovale. Right? 7th and 8th nerve. How does it get out? Through the internal acoustic meatus. 9th, 10th, and 11th nerve. How do they get out? Through the jugular foramen. And 12th nerve. How does it get out? Through the hypoglossal canal. This is very important. This is very important. ठीक है, समझ में आया सब? अब कोई भी cranial nerve जब आता है ना, any cranial nerve that you get, so these are the various foramens of the skull. Any cranial nerve, if it comes for you in the exams, कैसे लिखोगे? First is the functional components. कोई भी cranial nerve, first is the functional component, second is the nuclei. Third is attachment to the brainstem. Fourth is foramen exit. कौन से foramen से वो बाहर निकलते हैं. And fifth is extracranial cores. Sixth is muscles supplied. मतलब structure supplied. And seventh is clinical anatomy. So these are the structure, these are the points where you're going to describe a cranial nerve. Describe the cranial nerve under the following heads. ऐसे आता है. It's an LAQ, है ना? So describe the cranial nerve under the following heads. Functional components, for nuclei, attachment to the brainstem, for foramen, which it gets out through extracranial cores, the muscle supplied, and the clinical anatomy. Under this heads, remember the cranial nerves. So what we have discussed in this lecture is the foramen. ये हमने discuss किया. मतलब cranial nerve gets out through which foramen? हाँ, बस ये याद रखना. So this lecture was meant for the various foramens. एक बार वापस, what is this? Cribriform plate of ethmoid. What passes from here? Olfactory nerve. What comes in from here? Olfactory nerves. What is this? Optic canal. Optic nerve, ophthalmic artery. The superior orbital fissure, 3, 4, 6, and ophthalmic division of trigeminal nerve. Foramen rotundum, maxillary nerve. Foramen ovale, MALE. Foramen spinosum, the middle meningeal artery and the nervus spinosus. Foramen lacerum, internal carotid artery. Internal acoustic meatus, 7th nerve, 8th nerve, labyrinthine artery. Jugular foramen, उसके 3 compartments है. I've told you that. And hypoglossal canal, what gets out is the hypoglossal nerve. Foramen magnum के 2 compartments होते हैं. What passes through the anterior compartment are the ligaments and the bones. What passes through the posterior compartment are the nerves and vessels. So posterior compartment को हम बोलते हैं neurovascular compartment. Anterior compartment को हम बोलेंगे osteoligamentous compartment. Osseous मतलब bones, ligaments. Bones and ligaments anterior compartment से जाते हैं. So it is osteoligamentous compartment. Posterior compartment से क्या जाएगा? Nerves and vessels. So that is what we call as the neurovascular compartment. Neurovascular compartment. Fine. So can anyone tell me what passes through the anterior compartment of foramen magnum? चलो ये एक बाकी है, इसको भी खत्म कर देते हैं. अब foramen magnum ही बाकी है. So foramen magnum, can anyone tell me foramen magnum? What passes through the anterior compartment? That is the tip of the dens. Tip of dens. Dens कौन है? Second cervical vertebra is dens, or the odontoid process. Second is apical ligament of dens. Apical ligament of dens. And third is cruciate ligament. Cruciate ligament. अब ये जो dens है ना, dens is the second cervical vertebrae. आगे dens होता है, उसके पीछे कौन होता है पता है? Medulla. What passes to the posterior compartment? This is the posterior compartment. What passes is the medulla. Okay, just try to understand this. This medulla is exactly behind the dens. Anterior compartment में ऑडेंटॉइड प्रोसेस है जो है डेंस, ऑडेंटॉइड प्रोसेस और द डेंस. इसके पीछे पोस्टीरियर कंपार्टमेंट में कौन है? मेडुला. अब ये डेंस हैज टू बी केप्ट इन पोजीशन. इफ दिस डेंस इज डिस्प्लेस्ड, अगर ये हिल गया, इट विल हिट द मेडुला, एंड दिस पार्ट ऑफ द मेडुला हैज मेनी इंपॉर्टेंट सेंटर्स ऑफ रेस्पिरेशन एंड सर्कुलेशन, राइट? सो ये जो मेडुला है ना, यहाँ पे बहुत इंपॉर्टेंट रेस्पिरेटरी एंड सर्कुलेटरी सेंटर्स होते हैं. अगर ये डेंस डिसलोकेट हुआ, it goes and hits the medulla, the person gets an instantaneous death on the spot. Death, instantaneous death. ये कब होता है? hanging करते हैं, hanging. So hanging में the person is suddenly released ना, वो ऐसे खड़ा रहता है, and the support is removed, so the person falls down. Okay, the person falls down. Just wait. The person falls down and the dens gets dislocated, it hits the medulla, the person dies on the spot. That's the hanging, that's the concept of hanging. Okay, तो dens को position में रखना है, तो there are two ligaments जो dens को position में रखेंगे. One is the apical ligament of dens and दूसरा एक X shaped ligament है, that's a cruciate ligament. इसकी वजह से the dens remains in its place, वो ऐसे हिलता नहीं है. Fine, I'll just finish this. Amber, what passes to the posterior compartment is the medulla. Then what comes here is the spinal accessory nerve. Spinal accessory nerve. Then vertebral artery. Vertebral artery and vein. फिर anterior spinal artery. I'm writing in short. Posterior spinal artery. And tonsils of the cerebellum. Tonsils of cerebellum. So medulla तो निकल गया, फिर spinal accessory nerve goes in the skull, vertebral artery and vein enters the skull. उसके branches जो है anterior and posterior spinal artery, they go outside the skull, and the tonsils of cerebellum. So this is the foramen magnum. Remember this. This is always asked in the exams. ठीक है बच्चों? I hope this is clear to all of you. So this is about the interior of the skull. This is one short series of anatomy specially started from you, specially started for you from the PW team. Okay, I hope this is clear to all of you. Monday to Monday हम ये one short series रखते हैं and we discuss some important topics from exam point of view. Okay, I hope everything is clear to all of you. अगर किसी को कुछ doubts है तो पूछना. Sharp pain in the ribs. हाँ, वो कॉस्टोकॉन्ड्राइटिस होता है. कॉस्टोकॉन्ड्राइटिस is costal cartilage and ribs का junction पे there's a swelling, and when there's a swelling you get pain की वजह से fever आता है, and fever की वजह से WBC counts raise. So it is generally costochondritis. Arushman, fine. Amber Divedi, internal carotid artery supplies the brain. Internal carotid artery branches देती है, हाँ, and then it supplies the brain. जब MBBS में आओगे तब मेरा Instagram, you can search my Instagram page पे Dr. Pradeep Pawar search कर लो, you'll get it. ठीक है? Search for Dr. Pradeep Pawar. Fine बच्चों, clear to all of you. I hope things are clear. Internal carotid artery enters the skull through the foramen lacerum, and then फिर branches देती है. It forms a circle which is known as circle of Willis, जो brain को supply करता है. Fine. Thank you so much, my dear children. Thank you and have a pleasant night. Thank you so much. Bye bye. ठीक है अंबर? वो बच्चे चेक करना पड़ेगा बच्चे. ल्यूकेमिया के लिए WBC counts are extremely high. वो देखना पड़ेगा कितना हाई है ना? अगर नॉर्मल है, नॉर्मल इज 10,000 तक है, हाँ, अगर उससे थोड़ा सा ज़्यादा है तो देन दैट्स अ डिफरेंट थिंग. हाय अगराज, वेरी गुड वेरी गुड. यूल ऑलवेज रिमेंबर माई टीचिंग. हाँ, PW, yes. Thank you and bye bye. Thank you.